as our meteorologist from Shade has mentioned, Sahara dust is expected to move into Houston this week, and that will mean reduced air quality.
All right, so now joining us to talk about it is Dr. Christopher Campos with Kelsey-Seybold. First and foremost, thank you for joining us, Doctor.
Thanks for having me.
All right, so what kind of health problems can this dust cause?
Yeah, so one of the things that the Saharan dust is bringing is a thing called particulate matter, right? So what we want to see when the patients who are high risk is for them to either look at the what's called the U.S. Air Quality Index, right? You want to have something for high risk groups anywhere below 150, right? The range is from 0 to 500. With that said, high-risk groups are going to be those with asthma, they're going to be those who are elderly, children, and just those that are having reactive airway disease or just have breathing problems in general.
So what are you going to tell people who have these pre-existing conditions when they start noticing a difference in our air quality? Yeah,
so one of the things, obviously, if you notice those numbers creeping up to 150, all the way to 200, even 0 to 50 in those highly sensitive groups, you really just want to stay inside. If you cannot stay inside, you want to limit the amount you have prolonged exercise and the amount of strenuous exercise you're going to do. That way you can risk or decrease the risk of getting these breathing exacerbations.
Now we're going to see all of us are going to be impacted by this, right? Not only those with pre-existing conditions. So what advice would you give to everyone here in the Houston area?
Yeah, of course. So everyone who even is trying to go out there, first of all, check the AQI, right? That's the United States Air Quality Index. Anything below 200, you're pretty much in the clear, but you're going to see those hazy skies. It's going to give out for great sunsets, I hear. But with that said, you want to kind of gauge not only the AQI, but also your symptoms, right? So you want to see, am I able to breathe good? Am I able to do the things that I want to do out there? And can I do those with the correct kind of medical guidance?
All right, yeah, it can get pretty bad out there, especially a lot of people work out outside even though it's hot. Definitely just be careful, right?
Of course, yeah, of course. Just making sure that you have your on-hand albuterol or any type of inhaler that you carry. That way you don't run out. Make sure you see your primary care doctor and that way you can get your physical exam or whatever it is just to kind of get the health up to date.
All right, well, Dr. Christopher Campos, thank you so much for coming in. We enjoyed having you on the set in person and not on Zoom. This was fun. You're welcome back anytime.
I appreciate you guys.